Introduction. Nourishing Two Lives. Maternal and Child Health in Afghanistan. Today you hold in your hands something precious. Knowledge that can protect your health and the health of your child. In Afghanistan, many families face difficult realities every day. Poverty, limited access to healthcare, and diets lacking variety, all of which directly affect the well-being of women and children. Yet, with small actions and informed choices, it is possible to build a healthier future. The most important time to act does not begin only when pregnancy is confirmed. It starts even before conception. Researchers call this the preconception period, and it is just as essential as the well-known first 1,000 days, from the start of pregnancy to the child's second birthday, which determine much of a child's growth, cognitive potential, and lifelong health. A concerning situation. In Afghanistan, 74.7% of women of reproductive age suffer from iodine deficiency, and 24.7% suffer from anemia, mainly caused by iron deficiency and lack of folic acid. About half also face vitamin A deficiency. These nutritional gaps weaken the body, increase the risk of complications during pregnancy, and can affect the baby's development. Dietary diversity is often low, with meals repeating the same foods and offering few fruits, vegetables, or varied proteins. On top of these nutritional challenges come social ones: early marriages, closely spaced pregnancies, and unequal access to education and healthcare. Together, these factors make malnutrition in mothers and children more likely and more severe. Why act before pregnancy? A woman who wishes to become pregnant, or who could become pregnant, needs to prepare her body, just like preparing fertile soil before planting seeds. Nutrient stores take time to build. Iron and folic acid are indispensable. They help prevent anemia and can reduce the risk of neural tube defects in the baby's brain and spine by almost half. Iodine supports the brain development of the fetus. Calcium and vitamin D strengthen bones and help reduce the risk of complications such as preeclampsia. If these nutrients are lacking, problems can arise in the very first days of pregnancy, often before the mother even knows she is expecting. During pregnancy and after. Once pregnant, your body's needs rise. More energy, more protein, and more essential nutrients. You can achieve a diverse diet even on limited resources by combining grains with legumes, using seasonal vegetables, and adding milk or eggs when available. After giving birth, your body needs to recover while producing nutritious milk for your baby. This makes self-care, proper hydration, and nutrient-rich foods especially important in the postpartum period. The essential role of breastfeeding. Starting breastfeeding within the first hour after birth and continuing with exclusive breastfeeding for the first 6 months protects your baby from many illnesses and gives them the best start in life. From 6 months onward, gradually introducing other foods while continuing breastfeeding helps prevent stunting and nutritional deficiencies. Physical activity. Support for body and mind. Gentle, regular movement helps maintain healthy weight gain, lowers the risk of gestational diabetes, and supports emotional well-being. Walking, gentle stretching, or pelvic floor exercises can be beneficial during pregnancy and postpartum when done safely. After childbirth, regular activity can help restore energy and reduce the risk of postpartum depression. What you will learn in this course. Through the upcoming modules, you will discover how to choose local foods that meet your needs and your child's needs, how and when to use supplements such as iron, folic acid, iodine, and vitamins, safe, beneficial physical activities for each stage before, during, and after pregnancy, how to prevent and detect signs of malnutrition, practical hygiene and care practices to protect your family's health.